into specifics to some regard. I guess I like to use liposuction really as like a tool. People talk about it like a procedure, but really it's just like, it's kind of like a tool in my toolbox, like a scalpel or something like that. And you can use it all over the body. But it can do some really kind of neat things. So what I'm going to do today is I'm just kind of tell you a little bit about myself and the practice, and then we'll talk about awake versus traditional liposuction. And when I say traditional, there's also a lot of like different types and little adjuncts to liposuction. So we'll kind of talk about like each of those because it can get a little bit confusing if you're not a plastic surgeon. And then we can go over some questions. So I'm Dr. Hamwi. I'm a board certified plastic surgeon, which means I did like a residency specifically in plastic surgery. I'm from Ohio originally, but I did my training mostly on the East Coast and then a little bit in the Midwest. And then ultimately I ended up down in Sarasota because that's where my wife is from, and it's gorgeous and beautiful and fun down here. My clinical team, I've got a PA and I've got some estheticians that work with us, and I've got a staff of like nurses that help with like recovery and things like that. But these are like kind of the people that like provide services. So we do plastic surgery. We also have kind of like med spa services as well. But this is sort of Sarasota. Sarasota, if you're not from Florida, is sort of nestled in between Tampa and Fort Myers. It's got a airport that people fly into if you're from out of town. That's about 15 minutes from the office. And we're in an area called Lakewood Ranch, which is sort of like a new little suburban kind of community. This is the inside of the office. It's nice and pretty, and we try and make it inviting because I know that sometimes like medical things and especially surgery can be a little intimidating. But we treat people from all over the country. And at this point, someone just informed me that we've actually hit someone from Vermont. So we're just down to like North Dakota and South Dakota are like the only places that we haven't had patients come from. So the nice thing about liposuction is it actually lends itself really well to people who are coming from other places. And when you do this awake and you don't have that sort of added, additional like general anesthetic component, then, you know, patients kind of, they fly in and they fly home and they do really well with it in that regard. I do some other procedures too from people who are from out of town, but like liposuction is one that I feel really comfortable with. And so part of the reason people come from everywhere is because we can do some pretty neat things with liposuction. And so like this patient that's here actually came from like the United Kingdom. She was from England. And, you know, this was, I love her results. She looks great, but this is kind of like an example of really how powerful liposuction can be as sort of a sculpting tool. All right. And so why people typically sort of like investigate liposuction? Well, what people usually say is, you know, listen, I have these like fat deposits and it doesn't matter like how big or small I am. Like this is kind of like the shape, right? And if we go back to like this patient here and you look at like her flanks, what, you know, she would tell you is, yeah, it doesn't matter if I lose, you know, 20 pounds, I still sort of have this like bulge here. And, you know, in order to achieve this kind of shape, well, the weight loss alone isn't going to do that. Like your body sort of has a set construct that can grow and shrink, but it kind of keeps that shape. And so that's like a common reason people, you know, search out liposuction. Also this idea that you kind of have a little bit more volume below your belly button. These are like just kind of the way the body is built. And, you know, that kind of lends into this, like they're looking to change a contour that's been there their entire life. That's that same idea, is that like your body is sort of built a certain way. And when you gain weight or lose weight, it's not like fat cells are going away or showing up out of the blue. It's just the ones you have get bigger or shrink. So that's why you keep that consistent sort of like shape or proportions. The one time that does change is that when you've got hormone changes, your body can build new fat cells or grow fat in places that maybe it didn't have before. And so hormone changes associated with menopause, pregnancy, and to some extent weight changes people may notice that they're just built a little bit differently, and that's when they're looking for liposuction to help sort of polish up, some of the problem areas. Another patient population that we sometimes see coming in to talk about liposuction are people that have had tummy tucks. Because tummy tucks are great procedures. They can be very powerful for treating the abdomen, the part you look down and see, but they don't necessarily affect the silhouette part. And so sometimes we'll have a patient like this who had a tummy tuck, but she really wanted to sort of like accentuate or shrink her waist and her torso. And so we did that with liposuction. So that's another kind of like neat thing, and another way that like liposuction can be used even in people who have had some other like procedures. So ultimately, like, despite all of that stuff and like your body's built a certain way, we kind of desire to look and feel our best. And so liposuction can be a really great tool for that. So getting back to sort of awake liposuction, what is awake liposuction, and sort of how is this different from, what you may call like traditional liposuction? Well, liposuction in general is fat removal through small incisions. But when you do it awake, you're doing it under local, or what's called tumescent anesthesia, where you're pumping in a numbing fluid, sort of like the dentist uses. But that allows us to get the patient super duper numb, but keep them, comfortable and awake. And the reason I like that, well, actually, I'm sorry. We'll get back to like how this is done. So here we have a patient sort of before and after. And what you'll see is those little poke holes are sort of how the liposuction is done. So you're able to treat this entire area that I've marked through those little poke holes, okay? And I've got them, they are on the front of her too, but this is the patient before the procedure, and this is her right at the very end. And if you'll notice, she's kind of propped up on her elbows. She's awake, she's ready to get off the bed and kind of walk out and go home. But I put these incisions specifically in areas that are kind of covered by like bathing suits, underwear, bra lines, because anywhere you make a poke, you do get like a little scar. And some people scar light and it just looks like a little mole. Some people can scar dark and it can, be a little bit more visible. But those are the incisions. And then you perform the liposuction by using a small tube called a cannula, which goes, through the skin and into the fat layer. It's above the muscle layer, but it shrinks the fat layer, and we use that to reduce the fat. And while liposuction can be used as sort of a volume reduction tool, because that's what it's doing, it's really best used as a sculpting tool. And I like to think of that fat layer as like my block of marble. That's like what I'm sculpting in. And so there's essentially sort of 3 steps to liposuction. You numb the patient, you do the liposuction, and then you check your work. And it's that checking your work that I really think stands out when you're doing awake liposuction, okay? Here we have a patient. She's halfway done with her procedure. I've treated one side. I stand her up. I can make sure that it looks the way I want it. And then we go back and we can knock out the other side and then stand her up and make sure that we have symmetry and geometry and all the things just the way we want them, okay? So the analogy that I like to use when I'm talking about awake liposuction and asleep liposuction is, I don't know how, for any of you that have been around back before digital cameras, you guys remember when we used to take like pictures on a roll of film and you would take the film in and you never really knew what you got until you got the film back, right? Well, that is asleep liposuction. I like to think of awake liposuction like a digital camera, right? Nowadays, you snap a photo and everyone looks to make sure that they're smiling. And if you don't like it, you do it again, all right? Well, that's awake liposuction, all right? This idea that we can kind of check our work as we go. And I really like that because I think it allows me a little bit more precision and an ability to kind of like nitpick things a little bit more. So, when I was talking about liposuction being a tool and there being a bunch of various different types of liposuction, awake liposuction just means I'm using the tool, but I've numbed you up in a way where I don't need general anesthesia. where we can stand you up and we can kind of check our work. Now you can do awake liposuction and you can do, traditional liposuction, ultrasound assisted, power assisted, laser assisted. All these little things are kind of nuances that can be used with either awake or asleep procedures. Traditional liposuction typically refers to just using a cannula, infusing medicine into the tissue, and then just with your own sort of muscles, working in a back and forth motion, removing the fat. Ultrasound assisted liposuction was a device that was developed to help break up the fat using ultrasound, which then would allow you to remove the fat with the cannula easier. The idea being that if you kind of broke up the fat first and made it so it was it came out easier, that the surgeon wouldn't have to work as hard, that he would have a little bit more control over the shape and the contour, and things would, you would sort of be able to get the shape you wanted easier. And I think there's some truth to that. After that was replaced by laser-assisted lipo, and it was under the name Smart Lipo. The idea there was, well, if you can maybe melt the fat with a laser and get some skin contraction, well, then that would be a better way to sort of do a liposuction procedure. And for a while, that was really popular. They found that the laser wasn't quite melting the fat the way they thought it was, and it really wasn't creating the skin contraction that they thought it was. So that sort of fell out of favor. But people still kind of like that Vaser component or the ultrasound thing, because that worked pretty darn well. And then they came out with a power-assisted liposuction device, which vibrates. And that's what I have down here. And I'll tell you, most people who are doing a lot of liposuction are using this power-assisted. Whether they also include ultrasound or maybe this radio frequency stuff like BodyTite or Renuvion, the power-assisted is kind of the gold standard for liposuction in general. That's what I use. That's what most people use. There is a company out there that has this patented term. They call it AirSculpt. It's essentially just a power-assisted liposuction. I've got a bunch of buddies who had worked at that place, and then they sort of moved on and had started their own practices. But I think there's a lot of times a lot of branding of things. But at the end of the day, I think the most important part is that you find a surgeon that does good work, because all of this stuff is just a tool, and you need the right tool in the right surgeon's hand. The one other and probably the newest adjunct that's out there, and you're going to see this from time to time, are these radio frequency skin tightening devices under the trade names BodyTite and Renuvion. And these guys use radio frequency energy to help sort of cook the tissue after a liposuction treatment and trying to get skin contraction. The reason that is because anytime you're taking out any significant amount of volume, you're essentially creating a deflation effect. And so being able to create skin contraction really helps mitigate one of the big problems with liposuction, which can be skin laxity after a treatment. So I'll talk a little bit more about Renuvion a little bit later, because that's one of the ones that I really like, and we actually use that in the office a fair amount. So why I like awake liposuction, getting back to it, it's that real-time precision. It's the idea of that, the digital camera and being able to kind of check our work. Not using general anesthesia, not needing a machine breathing for you while you're doing the procedure. I mean, listen, I do a lot of procedures with anesthesia, so I'm not afraid of anesthesia, but if you don't need to use it and you can get better results, I don't see the need to. I do use anesthesia when I'm, say, doing a tummy tuck and doing liposuction at the same time. But all things being equal, I would say I prefer doing liposuction awake because of that ability to kind of I say nitpick. And then faster recovery, I will tell you the liposuction itself, I would say the recovery times are the same. The recovery time immediately after the procedure is faster because you don't have general anesthetic that your body has to metabolize. I do also find that when you're doing procedures awake, you have to be really, really careful and really, really good at making sure you get the numbing medicine everywhere that you want it. Whereas when a patient is asleep, you sometimes don't know if you've gotten the medicine everywhere you want it. And in that numbing medicine is another agent called epinephrine. And epinephrine is a vasoconstrictor, and it reduces bleeding, and that means less bruising. And so people are often shocked at how little bruising you get after liposuction. And I don't know, specifically my liposuctions, I don't know. But we rarely see bruising with these procedures, and I think it's because we're very good about making sure we have the medicine everywhere we need it, and you have to be when you're doing this awake. So who's a good candidate? Obviously healthy, non-smoker, those things are good so that you're healing, you don't have complications. But close to your happy weight. The idea there is that like you don't want to be too big. Liposuction, while it can be a debulking procedure, isn't its best when it's a debulking procedure. It's really its best when it's a sculpting procedure. You also want to have good skin elasticity. If you're only removing a little bit, well, you're not asking much of the skin in terms of contraction. But if you're removing multiple liters of fat, then you need to have good skin elasticity so you don't have loose skin or like that deflation effect that can be happening. And then looking for sculpting, this gets back to that idea of like how it's a better sculpting tool than just like a volume reduction tool. There's also limits to how much fat you can remove in a single session for safety reasons, and also for like results. But like in Florida, there's a law where you can't take more than 4 liters in a single session. So if you're using this for just a big debulking like procedure, you may not quite get what you want out of it because you're going to be limited to how much fat you can remove in one session. I have a question. Yeah, so someone asked, for a tummy tuck pouch, right? Like that little like skin fold down at the bottom. Is that like a liposuction or a tummy tuck sort of problem? And I'll tell you, it really comes down to how big it is and how important that is to you to have like a perfect flat result. Because sometimes, and actually if you've got skin elasticity, like good skin elasticity, you can take the fat out of there and it will snap back pretty well. I will say once it's kind of folded over on itself, it probably isn't going to be perfect, but I've seen people who like have been like, listen, I don't want the tummy tuck scar. Let's just like do the liposuction the best you can do it. And it's pulled in really, really darn well. And there's other cases where you're like, hey, listen, I know that this is going to like, not be flat or have an issue. And like, if you're looking for like tight and flat, like you should do a tummy tuck. And this is where the consultation becomes important because like we get to look at like each individual patient. And I can tell you, even with like virtual consultations where people send in photos, I've been doing this for over a decade. I've done thousands of these. Like I can tell pretty well like how things are going to end up. The one thing that has been sort of like tricking me is I've been pretty impressed with this thing called Renuvion, and I've been using it in people who I've been like, listen, like we should probably do this and things may not look great. And I've been like shocked at like how well it's been coming out. I still hate to sort of promote it as this like silver bullet, but like I tend to sort of like, I am conservative when like talking with people about like how the skin is going to look afterwards. Cause that I need to make sure that like, I'm going to give you something that we both love. Right. So, all right. So who's not a good candidate? If you're not carrying your fat under the skin, if it's not like stuff that you can pinch and it's like behind the muscle around your organs called visceral fat, well, that's stuff that liposuction can't get. Again, the like skin elasticity thing, sometimes patients like on GLP-1 agonists will have lost like 60, 80 pounds. They're probably not a great liposuction candidate because like their skin elasticity just like can't tolerate that extra volume reduction. Someone who wants like every part of their body treated, or if you're too skinny. And I will tell you, too skinny is a problem too. If you get into that last little bit of fat, that can create irregularity. So there needs to be sort of an optimal amount of volume. And so going back to these ideas of like visceral fat versus subcutaneous fat, this image right here, I love it. It's an MRI of 2 different patients. One has, the yellow part is the fat. inside their abdominal cavity is this visceral fat. And if you notice, it's sort of pushing out, kind of like a baby. And it will make them have sort of like a round, sort of apple-shaped core. And some of that is subcutaneous fat, the stuff that's under the skin. But a lot of that is because the volume on the inside of the abdomen is kind of pushing out. You can see how if you did liposuction on this person, and even if you got out all of the fat and the skin retracted perfectly, how they would still be sort of shaped like an apple, whereas this person who doesn't have that visceral fat sort of has those curves in the waist that like most people are sort of trying to achieve. Down here, I have a patient who had lost a bunch of weight. And so if you'll notice, like the skin elasticity is her problem. So this wasn't a liposuction patient. This was a tummy tuck patient. Moving to like people who are sort of like, hey, can you do my arms and my belly and my legs and my this and my that? Like, if that's the case, like you don't need liposuction. Like the GLP-1 agonists, the Ozempics, the Wegovy's can be super powerful in sort of like shrinking you down. And when, you're not just shrinking your waist, you're shrinking everything. And then when you get to a place where like you're at like a nice, healthy kind of goal weight, then we can go in and we can like, do some things to sort of like sculpt again. And actually that is what we did here is this patient lost a bunch of weight on her own. And then we came back and we sort of like sculpted up to give her the kind of the curves we want. Another thing is like, if you're too skinny and you're like, I don't know, like, my wife, she's tiny, but like when she does a sit up, like the skin folds, like that's not a liposuction problem. Okay. Like there are like certain positions that will always look bad. And don't beat yourself up because that these patients aren't liposuction patients either. So now is going to kind of talk about the procedure breakdown. I've described it a little bit, but we'll kind of get into it in a little bit more detail. So starting at the very beginning, what we like to do is we'll start with a consultation. And I do these in either like a virtual setting where people send in photos and we can either talk on the phone or do a Zoom call. We can kind of talk about the goals and expectations and things. Or people can come into the office and we can stand in front of a mirror and then we can kind of like, discuss them in that regard. But the idea here is that we sort of have a conversation about what you're trying to achieve and talk about you specifically and what kind of things we can get from the liposuction. That also allows us an opportunity to talk about your medical history and make sure that like this is going to be a safe and a reasonable thing. And then we come up with sort of the plan and make sure that I sort of understand what's important to you and I can demonstrate to you that like, all right, this is kind of what I think you're going to get, and that sort of hits the mark with what you're trying to achieve. So these are examples of like, sort of patients who maybe are like good liposuction candidates. You'll notice they've got sort of problem areas, right? Then like no matter how much they sort of like weight they lose, they, sort of like bulge in certain areas. And so liposuction is really great at bringing down lumps, right? So you take this patient and you can flatten out her belly. Or it's really good at kind of like sculpting the waist and bringing it in so I can follow the natural curves of the silhouette. Once you've sort of said, all right, like this is something I want to do, then I've got a clinical team that reaches out to you, and my nurse Denasia will call and kind of go over the procedure, like what to know before and after. And we will have talked about this in the consult, but this is another opportunity to kind of get into the nitty gritty because there are certain things that you need to avoid. If you're a smoker, you got to stop smoking several months beforehand. If you're on blood thinners, like maybe you're taking a baby aspirin just prophylactically, well, that would need to stop. And there are some funny things like fish oil and ginkgo supplements that can also be blood thinners. So we kind of go over those aspects in order to do this safely. It's important on the day of the operation that you're super, you're well hydrated. And unlike general anesthetic procedures where you're not allowed to eat or drink, in this case, we actually do want you well hydrated and to have a little food in your belly because hydration and a little bit of calories keeps the body happy and makes it so that the recovery is easier. And then we encourage people on the day of the procedure to come in wearing like comfortable clothing, and like stuff that maybe isn't their favorite outfit, because after the procedure, you're going to leak this, like, it kind of is like, looks like, we call it like pink Kool-Aid. And it's essentially kind of bloody water, and it can make a little bit of a mess for that first day afterwards. So a lot of times, like a baggy zipper, like sweatpants or something is like a great, is a great outfit. I've got a question about, is the silhouette lipo comparable to lipo 360? Yes. I will tell you, I call it the silhouette. Other people call it the hips, waist, the mid-back. There's no real medical anatomic term for like the flanks, okay? And so when we're doing a consultation, we try and figure like what are the important areas for you. And I will say that when people are talking about a lipo 360, they're talking about the entire 360-degree circumference of their torso. So the abdomen, the part you look down and see, and then also the sides and the back. Now, I typically split up the silhouette and the abdomen as two different areas, okay? Now, you can get them done together, and when you do them together, that is a lipo 360, but they achieve different things. So I don't necessarily do a lipo 360 for everyone. If you're someone that's coming to me because you really just want to focus on your silhouette, the way that you like fit in a dress, your shape, well, then we do the silhouette. If you're someone that says, hey, listen, I have like an abdomen problem, a belly problem, we'll focus on the belly. If you need it all, then we do it all. And at that point, it's called a 360. Now, sometimes doing a lipo 360, this is where we can get into some problems with volume limitations, right? Because if you're, if we think that we're going to max out our 4 liters on just the silhouette, then we don't have any more volume that we can take from the abdomen. So sometimes if we're trying to do a 360, we may, if we want to get it done in one, procedure, you may have to maybe not be as aggressive because you may run out, you'll max out on your volume. So then on the day of the procedure, you come in, we do our markings together in a little room where we stand in front of a mirror and we draw everything, kind of what we're like trying to go after. And then we go into a procedure room where I make small little incisions in the underwear line and the bra line, if we're talking about the torso. If it's for like a chin or jaw line, we do that sort of like right behind the crease in the chin or like maybe behind the earlobes. If it's arms, it's, by the elbows, maybe by the shoulder blade. But we make these, we give little shots with numbing medicine, and then we make a little poke that's typically about the size of like a grain of rice or smaller. And then through that little incision, that's where we pump in the numbing medicine. And then that area numbs the region that we're working on, but it also has that epinephrine that like minimizes any bleeding. So when you do these procedures, you're typically only losing like a test tube or 2 worth of blood. Like it's not like a big blood loss, and that's because of that epinephrine component. And I think that's also part of why we don't see a lot of bruising with this. And then the liposuction process itself, we go back through those small incisions with that thin cannula, that straw, and that vibrates on that special power-assisted micro-air device in order to kind of break up the fat. And that allows us to break up the fat and remove it and start sculpting, all right? And this is a patient from earlier where we had sort of done one side and we stood her up to kind of check to make sure it was the way we wanted it. And then we go back and we do the other one. And we're really contouring and kind of sculpting the areas. And then after we're done, if skin laxity or loose skin is something that we're concerned about and someone wants to use the Renuvion device, the Renuvion is this wand that uses a radio frequency trigger it sort of like has this energy blast that comes out the end of it. And for lack of a less crude description, it sort of like cooks the little collagen fibers that connect the skin to the muscle underneath and the skin itself, and causes contraction, which allows the skin to sort of stick to the tissue a little better, so you have less of the like looseness that can develop after liposuction. And the company Renuvion has some interesting like scientific studies where they actually show that like skin contraction continues for like a few months after the procedure. So anyway, I have been more and more impressed with this thing. I was a little critical of it in the beginning, but the more I use it, the more I really like it. And so I like almost always sort of recommend it with patients who are a little bit older. This is a patient who is 50 years old and wanted his abdomen treated, the sort of lower abdomen. And I was like, hey, listen, like 50-year-olds and liposuction oftentimes don't go together real well. So if we're going to do this, we really should use like the Renuvion. And this was him afterwards. And a lot of like the irregularities and things that I like tell people about, like, we just didn't see. And so, like I say, if in patients who I'm concerned about like skin laxity on, I always sort of throw it out as a possibility. There's some people that I say, hey, listen, I don't feel comfortable doing this unless we use Renuvion. I also have some colleagues who are like, listen, it's 2025. Like, this is the evolution. Like, we should be using this on everyone. I don't know. It's an add-on sort of an adjunct. So, I'm usually not using it for like younger patients, but it's worth at least talking about because it is something that like is very common in liposuction and a pretty nice tool to use. And then afterwards, another question. 2 questions? 3. Okay. Is being awake like hearing your teeth getting a filling at the dentist? No. There isn't that like grinding noise. I will say that my handpiece kind of rattles like an electric toothbrush. But one, it's not on your head. It's sort of away. And there's, we're like listening to music and we're like talking. Like people kind of find themselves in like a faraway world when we're doing this. We do several of these a week. And, nobody has any problems. They do really, really well. And quite honestly, you get to like really know people pretty well. And you just sort of like, I tell silly stories about my kids. And by the end of it, like we're wrapping up. What happens if you reach the limit of numbing medicine during the procedure? Well, that's a great question, right? So there's a limit to how much medicine you can use for safety reasons. And that limit is based off of how much you weigh. And that's another reason why sometimes we need to split up procedures because you can't treat too large of a surface area because of the limit to how much numbing medicine that you can use. And for safety reasons, I won't put myself in a situation where I'm overextending myself, where I feel like I'm getting too close to that maximum amount of numbing. So when we do these, we're never going right to the limit of what we can use. We will give ourselves enough of a buffer where if you're like, yeah, Dr. Hamwi, like, I don't know, that spot doesn't feel as numb as like the other spot, I can go back and I can put a little bit more in. What I usually tell people, my experience has been with like the numbing part of this, is that when we're putting the medicine in, on a scale of 1 to 10, like on a pain level 1 to 10, putting the medicine in is like a 3. It's an annoying, but it's not the end of the world. And it's not all the time. It's just every once in a while I feel a little pinch. And as I'm putting more and more medicine in, that 3 turns to a 2. And then the 2 turns to a 1. And then the 1 turns to a 0. And at that point, you feel sort of like a funny, like resistance or like movement. You feel that you perceive the shaking or the movement of the cannula, but it's not a painful feeling. And if you did say, hey, Dr. Hamwi, I feel a pinch, well, then we just go back and we put a little bit more medicine in. And then the last one was pain-free. I would say, again, like when I'm putting, the question was, is it really pain-free? No, when I'm putting the medicine in, like I say, it's like a 3 out of 10. But once I get the medicine in, yeah, it shouldn't hurt. And if it does, let me just give you more medicine. And then when we're done, then we put you in this compression garment and a and I typically put a layer of foam. So I've sort of been focusing a little bit on the body here. So I'll tell you a little bit more about that. But we talked about the pink Gatorade. That's the fluid. It's essentially the numbing fluid that I put in, mixed with a little bit of blood. And it leaks out of the little incisions that I made over a 24-hour period. And so some surgeons will actually put drains in. I think that's a little bit of overkill because it only lasts for one day. But we do expect that you'll sort of leak this fluid. And so we put a layer of foam over the area that we just treated. We then put on a compression garment, and then we wrap you in chuck pads, which are like dog pee-pee pads. They're like plastic on one side and kind of cotton on the other, and they absorb that fluid, all right? And then this is me sort of putting the foam on. This is a foam. This is the typical shape that's used after we treat a silhouette. It's got a cutout for where your booty goes, and it's got a little extra of a foam kind of bump right above your booty where you've got that sort of like flat part. It's called a sacral depression. And what this is doing, it's sort of like accentuating the shape that we created with the liposuction, and it goes underneath the compression to help give a little extra compression and give a nice smooth contour underneath the compression garment. Because compression garments are great. They help minimize swelling, and I like them for a variety of reasons, but they also can create indentations and creases that I don't love. And so we use that foam to kind of keep everything smooth. And so the compression garments come in a bunch of different varieties. We've got them here. We give you the one that like fits the procedure that you had, and we'll give you another one. So you've got one to wash and one to wear. But I recommend people wear these compression garments for 6 weeks. The reason that is that we know that the body glues itself back together over a 6-week period, and fat is a little malleable during that time frame. So you want to sort of guide the fat, and you want to maintain the shape that we created during that 6-week period. And then to make sure that everything's going just the way we want it, we want to check in with you at least every 2 weeks. So we do the procedure. We have you come back the day after so that we can give you new, clean, dry everything because you'll have leaked that like red Kool-Aid. And so we give you new foam, new garments. And then we want you to come back and see us at 2 weeks, 4 weeks, and 6 weeks just to make sure that the shape is staying the way we want it. And if you're from out of town, we have you send photos, and we check in and we do sort of virtual follow-ups in that regard. If you do get any bruising, it tends to sort of be in a silhouette down by at the edge of where your butt is. And the reason that is because that numbing medicine with that like red Kool-Aid stuff I was talking about, that the fluid that doesn't get out, like that can sort of be absorbed by the tissue, and then it sort of absorbs a little bit like a bruise. Swelling is a natural part of how the body recovers. That, you twist your ankle, it swells, but then it goes back to normal. We expect and we see swelling after liposuction, but you want to keep it under control, because when the body swells, it's not the cells themselves that are swelling, it's the space between the cells. And the body doesn't like spaces between the cells. It likes to fill that space with scar. And so the faster the swelling goes away and the less swelling you get, the less scar tissue will get laid down between those cells. And so I like to use this analogy of Play-Doh for fat after liposuction. The fat after liposuction is malleable in the way that Play-Doh is. And so you want to keep it nice and smooth and regular as it dries so you keep that shape. And you want to minimize the swelling so that you don't get a lot of scar tissue, because scar tissue can make things kind of lumpy, bumpy, or add volume that otherwise wouldn't be there. Okay? So wearing compression and the foam and keeping things looking the way we want them is an important component of like getting the best possible results afterwards. Okay? So what areas can be treated? I talked a lot about silhouettes. The silhouette, as I was describing it, is this area that goes kind of from like the stuff that squishes out the bottom of the bra down to the underwear line. It wraps around the front, and It, kind of accentuates the bottom. Part of my technique is this thing that I like to call buttock sculpting. If you'll notice, what I've done here is kind of gone over top of her bottom to sort of bring out like a little bit more definition within her butt. A lot of times people say this looks like they had a BBL or something, and no, we haven't actually added any volume here. We've just shrunk the rest of her. And by treating the fat over here like that block of marble, that's the stuff that we get in and we try and sculpt. And when you do that, you can create these sort of like contours like this, or like this. And then this sort of demonstrates, this patient had a tummy tuck. And so she really didn't need her abdomen treated, but she wanted a little bit more shaping in the waist. And so that's what we did. And so a silhouette for me kind of comes down at a little bit of an angle and then wraps around the back. Whereas I call this part in between here the abdomen. And specifically for people who have had tummy tucks, they usually don't need the abdomen. What they need is the silhouette, because the tummy tuck took care of the abdomen. And there's just another example of like the silhouette and this idea of like buttock sculpting. Is there another question? All right. So, I'd like to see some results of the waist area. Yeah. All right. So this is, someone just asked about having a tummy tuck and then what silhouette liposuction can add to a tummy tuck or, to a torso. And so here's a sort of another example of like what we can do. And I will say that like one aspect of liposuction is to some extent, we're sort of like revealing your frame underneath. So that's an important component of, what the results will look like. And when we're talking with individuals about what they can expect from the procedure is like what your frame is, because liposuction can't make you any skinnier than your rib cage is, right? And so your bony structure is sort of set, and then the fat on top of that is that marble that I like to sculpt in. So this is someone that had their silhouette, and then they had their lower abdomen treated, right? And so this is kind of what I would call the lower abdomen, as opposed to like the full abdomen would be all of this area up here. Here's someone who had the full abdomen, right? And so that allows us to like bring the abdomen back. And this is where, why I treat the abdomen and the silhouette differently is because silhouettes affect the way that you look from the front. Abdomens are what you look down and see or what you see from the side. They're different, and it's why like a tummy tuck doesn't necessarily create silhouette shape, and why abdomen liposuction doesn't necessarily create silhouette shape. Here's another abdomen. You kind of flatten that out. I think I may have also done the silhouette on her because you can kind of see the extra shaping of the buttocks there. Here's another person who had their abdomen done. And again, we sort of will design this for like whatever you need. If you just need the bottom, the top. If, there's usually when we're treating someone who we're just doing the abdomen on, there's usually kind of like a flat, skinny area in here, and then the volume starts to show up. And so that's where the personalization of this comes into it. And then here's someone where we did both the abdomen and the silhouette, but you can still sort of see my sort of like standard markings. And then abdomen and silhouette, she was looking for, a little bit more of an augmented sort of like waist thing. So we can kind of work on that. Upper back, this area, a little note about upper backs in general. So upper backs are a challenging area. And sometimes it's kind of this in here. Sometimes it's sort of like a fold that kind of squishes out the bottom of the bra. The skin in the upper back is a little bit thicker stuff, and it's got a little bit more memory to it. And it also, sometimes when you have a fold that kind of squishes out the bottom of a bra, that's as much a skin problem as it is a volume problem. And so when you take out the volume, you haven't like necessarily like corrected the skin problem. So what we usually tell people when we're talking about bra bulges is that like we typically expect to get about 50% of the 50% better. Sometimes they get 100% better, but I like never tell anyone that it's going to get 100% better because I've been fooled before. I've done so many of these, and I've been fooled too many times. Where I typically say, listen, like there's a lot of reasons that you get the bulge underneath the bra that aren't just fat. And so, you know, if that's something that you're looking at treating, like it may not go completely flat. And you really have to have really good skin elasticity if you expect it to. We also do chin liposuction, okay? Volume underneath the chin, and we can do some cool things with chin liposuction. Now, again, it needs to be a volume thing. It can't be a skin problem, or it can't be a structural problem. But assuming it is just a fat thing, you can treat the chin and do some cool things there. In men, we do chests. I got another question. Let me see here. Apologize. Would this procedure work with an apron belly? It can, but in those cases, an apron belly is where the skin kind of folds over on itself. And liposuction is not designed for that. Like that is a too much skin and sometimes too much fat problem. But liposuction is a tool for fat. It relies on the skin's elasticity to contract. And so in those situations, patients are looking for volume reduction at the expense of like skin laxity. And, you know, I've treated patients before that were comfortable with that. And I have had patients who are like, listen, no, like that wouldn't be a win for me. In which case then we talk about a tummy tuck. This is chest liposuction for something called gynecomastia. And it's for guys who have volume in their chest. We also treat it as lower abdomen in order to kind of like bring that in as well. So anyway, liposuction is a tool. It can be used anywhere that there is subcutaneous fat, meaning fat under the skin. But you know, it's a tool, just like a scalpel. It's not like in itself like what you say. Oh, I got liposuctioned. So now I'm going to get into some like frequently asked questions, and then if you guys wanted to chime in with any other questions, I'm happy to like answer those as I go. But you know, people often say like, how soon will I see the results? Well, I mean, essentially immediately, right? And that's that idea of like being able to stand up and kind of check to make sure that like things look the way I want them to. Now, there's a swelling component that develops over the first like 2 weeks, and so the body, the inflammatory phase of healing kind of peaks around 10 to 14 days. And then you'll start shrinking again. So what we tell people is expect you're going to get swollen. It shouldn't be crazy. It shouldn't look like nothing was done. If that happens, like I need a phone call because like something's going on. But expect to get swollen and then to see yourself shrink. And so we usually see kind of swelling peak at that first post-operative visit at 2 weeks. And then at 2 weeks later at the 4-week visit, they've started to see themselves shrink a whole bunch. And then they see themselves shrink even more at the 6-week visit. And usually by 6 weeks, 80% of the swelling is gone. And so that last little bit goes away over like months. But that like at 6 weeks, you kind of got to get a sense of like what's going on. And that's like, everyone's like, yeah, this looks great. Like if it gets better, awesome. But if not, like this still looks awesome. But like we usually at 6 weeks say, go live your life. Don't like, you know, you don't have like, you're not going to mess anything up. How long do the results last? Well, the fat that we remove, those cells are gone forever. This is the idea of liposuction, is we sort of reset your baseline. Now, we don't take all of the fat. You have to leave some fat attached to the muscle, and you have to leave some fat attached to the skin so you don't injure those. And the fat cells that we leave behind can still grow and shrink. So this isn't a weight loss procedure. This is a sculpting procedure. And so as long as you sort of like stay your current weight, well, then this is your new body's new shape. I do like to tell people that it's usually best to do liposuction when you're a little heavy as opposed to when you're a little thin. because, I have to leave a little bit of fat behind. So if you come to me and like there's not much fat there, I can only take a little bit, and that little bit may only be 20% of whatever's there. And so if I bring you, from this to this, as opposed to me, if you come to me like this and I bring you to that, well, I've taken 80% of what's there. I've taken both patients to the same thickness, but that patient that came to me like with a little bit more, thickness, if they lose, 5 or 10 pounds afterwards, they get even smaller. They look awesome. Whereas if you come to me when you're like the skinniest you've ever been, and I get you from this to this, that may not feel like a win for either of us. And this is the skinniest you've ever been, and you're going to gain weight. Well, that's going to get bigger. No, like liposuction is one of the few procedures where I actually like you just a little bit heavy and then lose the weight afterwards. Whereas things like tummy tucks or lifts where we're like pulling things tight, I typically ask those patients to lose the weight first and then do the procedure because you don't want that deflation effect occurring. Is the procedure painful? I think we kind of talked about that. I don't want to like sell this as like that, like you don't feel anything. Like, yeah, when I'm getting you numb, it feels like little pokes, but it should feel like little pokes. And when the liposuction is happening, it should feel like vibration. I have a question about what type of liposuction I perform. So I do awake tumescent local anesthetic with power-assisted liposuction using the Micro Air PAL and with or without Renuvion, which is radio frequency triggered like skin tightening. How long after a procedure can you start working out? This all comes back to swelling and this idea that the tissue is malleable. So when you work out, that creates swelling. When your heart rate goes up and your blood pressure goes up, it's pumping through all the little capillaries in your body and your fingertips. And after a liposuction procedure or any injury, the body naturally makes itself leaky in the area that was injured. And so your body will dump fluid into the areas that were treated with liposuction if you work out. And so someone's like, well, what if I had arm liposuction? I adjusted my legs on like a stationary bicycle. Yep, you'll get swollen in your arms because your circulatory system doesn't care. It's pumping blood to everywhere, right? Can liposuction help with cellulite? Unfortunately not. Cellulite is a tricky problem that's created because of those collagen fibers that attach the skin to the muscle layer. And so what happens is that as those little collagen fibers kind of come up, they're sort of like tree branches that come up and like attach to the skin, and they can become calcified and pull down. And as they pull down, it's sort of like a quilt, how it kind of pulls down in like the middle. It creates that little dimple. And so liposuction doesn't really do anything for that. People talk about they've seen liposuction help cellulite. They've seen liposuction make cellulite worse. They've seen it do nothing. It's just not in itself really a cellulite procedure. And in some patients, it actually can make cellulite worse. In the same way that losing weight can kind of make cellulite worse because that deflation effect where the skin gets looser, the cellulite may show up a little bit more. There are procedures that are specifically for cellulite. I don't specialize in them, but there's an interesting device called a Veli if you're looking for help with cellulite. There are things out there like that. Can awake liposuction be combined with other procedures? It can. And actually, I do sort of an interesting arm lift where we do liposuction to kind of sculpt and shrink the arm. And then the extra loose skin is removed with the arm lift. And you can do mini tummy tucks with awake liposuction and things of that nature. So yes, it's a tool, and we use it with other tools sometimes. And then what does it feel like? It feels like vibration. That power-assisted micro-air device, it vibrates back and forth. It kind of rattles like an electric toothbrush, and people sometimes say it feels a little bit like a vibrating massage chair. So ultimately, if anyone has any other questions, I'm happy to answer them. But when it gets into like looking at an individual patient, what we do is we set up a consultation, and that idea of like a virtual and in-person consultation, if it's more convenient for you to send in photos because you live in Oregon or something, that's great. Or even if you're down the road in Sarasota and just like have trouble getting off time from work, I'm happy to like talk and tell you what I see. Otherwise, if you want to come in and have me kind of feel, I'm happy to do that too. There are certain situations where if like people are particularly thin and I say, hey, listen, like I don't see anything in this picture that I can treat, but you could come in and maybe there's something in person that I see that like I might be able to like, help you with. The other situation where in-person consultations are really helpful is if we are worried about skin elasticity. Because what I don't want to do is I don't want to like do a procedure and then create skin looseness that like you don't love, because that doesn't feel like a win. And so sometimes like coming in and having me like kind of feel what the tissue feels like, what really helps me like determine if this is like a good idea. And then like after the consultation, and you've said, all right, like this sounds good to me, I can have one of my surgery schedulers send you a quote or give you a quote. And they're also the people that know my schedule. I usually tell people whenever they do like a consultation, think about when like the right time in your life is for this. When you have that 6-week period where like life is pretty mundane. People usually go back to work after a week or less, depending on how big or small the area is. But you also want to make sure that you're like not doing it when you're like training for a marathon, or you have like a golf tournament you're going to be in, or a wedding where you're like the maid of honor and you need to be like drinking and dancing. So these shouldn't incapacitate you, but they also like, so that you get the best results, you want to pick the right time. And then once you've sort of like said, all right, this is something I want to do, and you've picked a date, then we have a whole little pipeline where someone from our office will reach out to you to set up like the preoperative like phone call with Denasia to talk about what to do and what not to do in preparation. We actually schedule all of your post-op visits beforehand, so you know when all those are. I've got another question about how long do quotes last? I don't know how long. 90 days? 90 days. I'm being told 90 days. And that's about it. So if you want to contact us, we're Florida Plastic Surgery. We're at floridaplasticsurgery.com. If you Google us or my name, all of the things will pop up, and you can give us a call or send us an email, and we'll get back to you. So anyway, I hope that was informative. And yeah, wonderful. Thank you so much, everyone. And I look forward to hearing and meeting you.